what may have changed from last week when we had our original discussion to this week? Well, here in St. Kitts and Nevis, we have had quite a spike of cases since then. From the original outbreak, I believe we've had over 40 plus cases, if I'm not mistaken my numbers, since then, which is a large number for this population. And we've been tirelessly contact tracing individuals, so I would assume we would expect more. So this is becoming a reality to the population here in St. Kitts and Nevis. I get calls every day about what to do. I may have been in contact with this person. Should I get tested? Should I go to work? Should I stay at home? And people are, extremely worried because, their way of life can be changed in an instant. They can be put to quarantine for 2 weeks, and they're worried about their health. Some people are worried about the symptoms they may have. So this is what has changed from last week to this week here in St. Kitts and Nevis. This is what I've been noticing.
Thank you very much, Dr. Sebastian. I'd like to invite Dr. Colette Lee Lewis. Dr. Lewis?
Well, since last week, I'm going to speak about the local situation here in Georgia, where I am. We were one of the first states to kind of open things up. However, our vaccination rates have not met that 70% number. We're far from that here as one of the southern states. But in our local community, the community that I serve here in Brunswick, in our local hospital, the cases have gone markedly down since vaccination. I think yesterday or the day before when I was in the hospital, when I asked, we only had one ICU patient and probably 2 on the floor. So we were down to about 2 or 3 patients. So vaccination has definitely made a drastic impact on the number of patients who are being hospitalized with COVID.
Thank you very much. Can we invite now Dr. Leonard Richardson, your comment?
I am sorry I came in a little late, so I didn't hear the question.
All right. Essentially, I'm just inviting each presenter to just share with us in 60 seconds or thereabout what may have changed or remained the same since our last conversation before we begin to take our calls this evening.
What has changed here in Maryland is we've had a pretty successful vaccine rollout, and we're beginning to see the results here. So I can actually say that it's sort of a best practice model.
Excellent, excellent indeed. All right, can we hear from Dr. Julian Wint Martin? Dr. Martin.
Yes, so for us in Alabama, in the pediatric ER, we have noticed that there's significantly decrease in the number of patients we're seeing. In the area that I live in Huntsville, people have been very receptive to the vaccine. And so we have majority of our population, I would say maybe more than 50% are vaccinated in the area that we live. And it's reflecting in a significant decrease in the pediatric population that are coming in to the ER and testing positive for COVID-19.
Thank you very much. I'd like to invite now Dr. Raphael Quantash. Dr. Quantash.
All right, thank you, Mr. Marcus. Yeah, I think my experience is almost the same as Colette and Judine. In all the society that we are in, people are a little bit more receptive to the vaccine. Those that are going to be vaccinated, I think, have already been vaccinated, and that has translated into a tremendous decrease in the amount of patients that I have to be admitted every single day, rounding on, and sometimes admitting them to the ICU. I'm yet to see one single patient that is vaccinated and has been admitted. Those that I'm admitting now are those that have refused or in some way have not been able to get a vaccine. So from my perspective, I think the vaccine has tremendously helped.
Thank you very much. And I'd like to invite now Dr. Winston Martin. Dr. Martin.
Hi, good evening, Mr. Backus, and just doing a little bit of house keeping here. A hearty welcome to the viewing and non-viewing listeners in the Federation, the Caribbean region, and around the world. And I'm quite elated and honored to be invited back again to address the COVID-19 issues and its impact on the Federation and the region. And thanks to the other members of the panelists who are mostly medical professionals, and they have very inflexible schedules, and they were able to bend them to address such a serious issue. And thanks to our U.S. Ambassador of St. Kitts Nevis, Dr. Thelma Philip Brown, for coming forth and sponsoring this program once again after she realized over the weekend there was a spike, and she thought this was critical. And to the staff of WinFM for working this program despite of the curfew. So welcome everyone, and let the wheels start turning.
And thank you very much. I'd like to also let our listeners and viewers know that we have as well Jade Johnson and Trent Sargent providing technical support for this program. Our phone numbers are 718-285-6984, 718-285-6984, 305-921-4619, 305-921-4619, 033-344-0065, 033-344-0065. Our local numbers are 466-0989, 466-0989, 762-0989, that's 762-0989, and we also have as well 662-0989. So those are our numbers. If you'd like to give us a call and interact with the panelists and pose a question, you can do so. What we did as well, we invited questions via email. So we have some questions already in hand to begin the discussion, but we also give you a chance, if you call, we'll give you a chance to pose your questions as well. What I'd like to do is pose the questions I have, perhaps one or two or three, so we have a very fulsome panel. I want to begin by posing a few questions and allow the panelists to answer them. I'm not going to necessarily call you directly to begin our discussions, but if necessary, I will call you directly by name. One of the issues that we're dealing with is the issue of vaccine hesitancy. And we've heard from many people as to why they believe there's such an issue. We want to hear again tonight from you. You've had a whole week of new experiences, or perhaps same experiences. And perhaps there may be something you may want to share with us that could make us understand a lot more about some of the issues involved with this. And what do you say to leaders, community leaders, political leaders, significant people, influencers as we now call them, who have been discouraging people from taking the vaccine and telling them it's not in their interest to take the vaccine? And you've had postings as well online making arguments against vaccination. And within that, I'm going to ask one more. We've seen in Jamaica, I think the target population has been over 60. I think you have over 3% now fully vaccinated. The government is now offering $10,000 if you take the vaccine as an incentive. And then we have Alabama, which I was reliably informed is doing quite well in terms of overcoming vaccine hesitancy. So can you help us to understand the arguments, the pros and cons of vaccine hesitancy, and offer as well your insight and expertise? Who would like to begin first? Okay. All right, go ahead, please.
I think there have been so many reasons for the vaccine hesitancy. You know, it's just different factions of the population, you know, have their own reason. I don't think it's a uniform one decision that is just standing out to everybody. You can ask many people at the same time, and they will give you so many different reasons why they have been quite hesitant in wanting to get a vaccine. One that I typically tend to get in the vaccine clinic that I used to, that I run here in Decatur, is that some people think that a vaccine has been developed too quickly. and that they think that the type of setup of vaccine that we've been using, which is the mRNA, will somehow alter the genetic makeup of the individual. And I mean, though the technique is a little bit new, it is not entirely new. I think it's been around for a couple years. It's just that we have the opportunity now on a wider scale, but the safety and the efficacy is second to none. And that's what I keep assuring everybody, that the technique appears to be new. It's not the normal one that we are used to, but it's probably more efficacious and more very safe to be used. So whenever I explain to them about this, they tend to be a little bit more receptive. But I think there are so many million reasons why people tend to be hesitant.
And Mr. Backus, I would address the political issue, and I have some thoughts for those who are politically expedient and use vaccine as a wedge issue to further discourage and dissuade individuals from taking the vaccine as a way to creep back into political dominance and relevancy. I would say don't do it. It is unethical, dishonest, and unappealing. And I think it will backfire in the end politically. Do not play political football with this issue. Find another constructive path to become politically viable. You could say the government didn't act fast enough. They don't have enough stimulus to put into the economy. I would say that all politicians become a statesman. This is a time to come together. The injurious impact of COVID-19 have been felt across the globe. This is not St. Kitts Nevis Federation issue or a Caribbean regional issue. This is a global issue, and we should really get to come together as a people and to save people's lives and our livelihood and economies. So that is what I have to say to those who are being politically expedient.
And Dr. Wink Martin, I did raise the issue of Jamaica. I know you're Jamaican, and I know you'd want to respond to my comment because I picked on Jamaica because you're on the panel as well, and I don't have anybody from Antigua and Barbuda or Guyana, so that's why I mentioned Jamaica. Go ahead, please.
So with Jamaica, I think, there's a number of reasons. The internet now it can be our best friend. It can provide information, but it can also be our demise. There's a lot of political, the negative political things that were put into the vaccination, especially in America. And so if you're reading the news, you'll see all the false information that's been shared about, it's the open quotation, the mark of the beast is one of the biggest things that I hear. And as a Christian girl that I grew up in Jamaica, my entire Sunday school learning, they talked about the mark of the beast, and that when that's offered to you, you should refuse it. And so to that population, they're thinking, someone's putting something foreign into me. I saw a video recently of someone putting a magnet on their arm and saying that the arm that got the vaccine held on to the magnet while the other arm that didn't get the vaccine didn't. And, so things like that, to layman people who don't, who are basically, feeding off things that are on the internet. If it's on the internet, then they think it's true. And so that's why in Jamaica, it's important, and just not Jamaica, but around the Caribbean in general, it's important that we are out there and they're hearing voices and they're hearing people that look like them and are from the same, geographical areas that they're from, that say that I got it and I'm okay, my kids got it and we're okay. And we're telling you that you're going to be okay. So I think sometimes people just want reassurance. They don't know what to believe when they hear so many different things on the media.
I take the point about wanting to hear from people who look like you and who sound like you. You like to hear your accent. You have a sense of trust, and you think perhaps that they're well-meaning. Now, to the issue of Alabama, what's the Alabama story, Dr. Kwanzaa?
Yeah. Yeah, the when the COVID really hit, it started from New York, East Coast. Um, we thought in Alabama it would probably not gonna come, and eventually, it was just a matter of time. The virus moves with people. Anywhere people moves, it's gonna follow. So I think we were probably a little bit late to react. But then it becomes a nationwide issue. It went everywhere. Now, I think Alabama in particular, um, the vaccination has been a little bit prosperous because right from day one, I think there have been a very robust campaign about wanting to get people vaccinated. You have the main hospital authorities going on the television, doing community communications to the leaders in the community, to the schools, to almost everybody that needs to hear about how important the vaccination is and how safe it is. And I think that is what has really driven down to almost everybody. And most people have been quite receptive. As I said, the majority of the people that are going to have the vaccine have already been vaccinated. What we are doing now is we kind of doing drive with a hospital. There's a bus that is from the hospital that would drive to the communities or would drive to the churches or the churches. And now we have in schools being set up for the upcoming school year for the kids to be vaccinated. So there are so many little things that we're doing that is really paying off.
Dr. Sebastian, what are you hearing and what do you say to people who are not yet vaccinated?
People who aren't yet vaccinated, I understand the hesitancy, I understand your concerns. They are all real. Everyone has fears and concerns, and they have their own reasons. But COVID-19, the actual virus, it doesn't care about your fears or concerns. It's here. We know what this infection does to individual. It's multi-systemic. It affects you in every way possible. Your lungs, obviously, but then your hearts, your kidneys, and it can even affect you financially, because if you're sick, you can't go to work. If you're infected here, you have to be in quarantine for several weeks or until you test negative. So it affects your life in so many ways, and then you have long-term complications from this. So the vaccine, so far, I believe close to 2 billion people in the world has received a vaccine, at least one dose of the vaccine. And the world, the actual real-life effectiveness of the vaccine, like my colleagues have been saying, it's apparent where they are. And we can benefit from that here in St. Kitts, especially since we're just, I guess, beginning our journey against COVID-19. This is our first real outbreak compared to the rest of the world. So we're just starting from we're just at the beginning of this, at the curve. So I would recommend individuals to go get vaccinated. If you're unsure, reach out to your doctor. We have many information sessions going on where you can learn about the vaccine. So please at least reach out, do your research through these means, and hopefully you will take the vaccine, because it's one of the most important ways that we can move forward and get over this pandemic.
Well, parents, I'm going to ask you to bear with me a bit, because I'm going to ask you direct questions shortly, but I'm going to put some questions to you now to see who would want to share their thoughts on these questions. And let's talk vaccines now. What are you hearing about the vaccines? Why AstraZeneca? Is it a poor man's vaccine? Why not Pfizer? Why not Moderna? Why not wait until we have the vaccine from Cuba? There's a new strain out of COVID-19, one person put to me. I have 6 pages of questions, so I'm trying to like put them in a short version so I can get as many in as I can. So bear with me if I sound a little confusing, and if you need me to repeat the question, I'll do so. So the vaccines again. Why AstraZeneca? Why not Pfizer? Why are we getting that? Why are we not waiting for the Cuban vaccine? Also, new strain of vaccine, new strain of COVID-19. Is the vaccine effective against this new strain? And with our human behavior combined with the new strains, are we going to have any relief anytime soon? So I want to put that to you and see who would like to perhaps explain to our listeners, our audience as well, why AstraZeneca, is the vaccine effective against the new strain? And basically, what do you want to say in that context as we talk about vaccines? Who wants to go first again?
Okay.
Very democratic process, very democratic.
I'll go
Yes,
first.
go ahead, please.
So regarding why AstraZeneca, for this region of the world, and for St. Kitts and Nevis especially, AstraZeneca made the most sense here, reasons being that once we knew that AstraZeneca was safe and effective, and it was approved by the World Health Organization, we needed to look at, one, how it can be stored here. The AstraZeneca can be stored on regular refrigerator temperatures, so we already have the infrastructure to store this vaccine here compared to Pfizer and Moderna, which would require ultra cold storage in like negative 70 degrees Celsius and negative 30 degrees Celsius. We don't have that infrastructure here in St. Kitts and Nevis. That vaccine also would need to be transported in that temperature. And if it's thawed, then the length of time that it is usable drastically reduces to a couple of days, I believe. And it would be a huge amount of waste if we had brought the Pfizer or Moderna here, because we just don't have the facilities to keep it viable and usable here. So that was the main reason why we didn't bring the Pfizer or Moderna here to St. Kitts and Nevis. We already are having a bit of waste of the AstraZeneca, and that lasts, I believe, 6 months when stored properly. So there's vaccine hesitancy as well. So coupled with a vaccine that wouldn't be able to be stored long here, it wouldn't make much sense for mass vaccination here when we're trying to vaccinate an entire population. Well, 70% of the population, I should say.
Thank you very much, Dr. Sebastian. Anyone else?
I'd like to piggyback on that a little bit. It also depends, when you look at vaccine distribution, it's going to depend on where you are and who the regulating agencies are. In St. Kitts, for instance, COVAX is usually the distributing organization, and PAHO is the recognized agent that interacts with the COVAX folks. Now, if you were in another Caribbean country, or if you're in Latin America, there's a different protocol. So the World Health Organization is who St. Kitts usually follows, and the vaccines that are authorized by the World Health Organization are currently the Pfizer, the AstraZeneca, the J&J, and the Sinopharm. So as Dr. Sebastian mentioned, these are the rules within which the CARICOM and St. Kitts operate. So they can go with what's available. And certain things there are certain limiting conditions like Dr. Sebastian said, the way that it's transported, the way that it's stored, we need to have all those things set up. So we go with what's available. And that is the best vaccine. The best vaccine is what you have available, and that's what you need to take. So the first question, I think, was why AstraZeneca. That is why AstraZeneca is now the one that's being taken. Now, President Biden just authorized $500 million worth of vaccines to go to different countries, and he's donating these to COVAX. That may very well mean that we may now have access to some of the alternate vaccines. Still have to make sure we have the necessary storage facilities and transportation to make that happen. So there's still limiting factors that we have to think about. The other part was why not the Cuban vaccines? The Cuban vaccines, I think they have 5, Saberna, Adela, and 3 others. They are in phase 3 trials, and phase 3 trials mean that they're not ready for prime time. They still have to be authorized by the bodies that the various countries use, whether it's the CDC in the United States, whether it's the World Health Organization in the Caribbean in CARICOM, or whether it's the MHRA in Europe or in England. So that is what the limiting factor is there. The other question you asked was new strains.
Yes. Mm-hmm.
New strains. So yes, there are new strains that evolve all the time. You have right now they've changed the designation to alpha, beta, delta. Alpha, beta, gamma, and delta, with alpha being the UK Kent strain and South African strain, followed by the Brazilian strain, and finally the Indian strain. And now you have in India, you now have a combination of the UK and the South African variant, a new virus that's evolved. So yes, the virus is evolving. What we know now is that the current vaccinations are effective against these strains. So that's the benefit of the current vaccinations. So if we continue to vaccinate, then what we're doing is limiting the spread of this virus. We've already shown during this short time, because we were so effective in the mitigation efforts against COVID, we have actually, a few of the flu strains have gone extinct, because the only way that a virus can propagate is if it can go from host to host, and that's how it lives. So if it can't, then it dies out. And there are some flu strains that are now extinct because the flu also couldn't travel. So, there's hope with that. So the last part of the question was the human behavior. As you can see, if we don't continue with mitigation efforts, if we don't vaccinate, what we're doing is creating an environment for the virus to propagate, to live, to continue evolving, to continue mutating, and so forth. So our best bet is to stay involved, stay vigilant, get vaccinated, and protect ourselves. And just to add a little bit on the hesitancy part, I think hesitancy came about not because we were reluctant to take the vaccine. I think with more information, we have a lot of information. If you don't know how to decipher the information, one can get a little confused. So now that we have more access to information, it does not necessarily mean that information we get is true information. So we have to be sure that we use sources that are reputable. So make sure that the source of your information is reputable, and then focusing on the best practices, those practices that work, and that's how you make sure that it happens. And also, you have to also think of the divide between the society. You have, first of all, generational divide. You have the older folks and the younger folks. They listen to different messages. They listen to different mediums. So you have to reach folks where they are. You have to make sure you listen to them first and foremost, because if you're not listening and they don't feel heard, then they're not going to believe you. So you have to listen to folks, and then they're more inclined to listen to what you have to say. Your message should be culturally tailored to that community, to that generation. And you have to use multiple ways to communicate with people. I mean, there's a digital divide. The younger folks are more computer savvy, more savvy with the social media. So you have to deal with this on the micro level and also the macro level. And that's how you combat hesitancy, by listening to people, and forums like this where we can come out and have conversations and just let folks know what is truly going on, and allow them to ask questions and, answer the questions.
And speaking about questions, I have a question here for Dr. Collett Lee Lewis. Doc, NCDs are rampant in the Caribbean, and we talked about being culturally sensitive and being culturally literate. What do you say to people who may have hypertension, diabetes, sometimes both, and who have not yet taken the vaccine? What experience? I'm not talking about a horror movie here, scary movie 2 or 3. I just want you to tell them why this is important and what you've experienced in treating people who come to you for help.
Okay. Well, thank you for the question. Especially here in the South, which is like the Bible Belt, just typically we have such a high prevalence and incidence of high blood pressure and diabetes, and obesity. So with those 3 issues, we are seeing that patients who develop COVID-19 infection are extremely at high risk for developing serious infection, not only COVID pneumonia, but then also developing a lot of the comorbidities and other problems that go along with that. So those patients are at higher risk a lot of times of requiring ICU care. Sometimes they end up being on the ventilator. Because of the high blood pressure and diabetes, a lot of them also have sometimes underlying kidney issues. And so having the underlying kidney issues also puts them at increased risk for worsening of the kidney problems that they already have. A lot of times they go on to have worsening kidney injury to the point that they need dialysis, what we call kidney replacement therapy. Dialysis, where we have to put them on a machine, clean the blood. That's one thing. Another thing is that those patients, a lot of the time, with the high blood pressure and the diabetes and the kidney issues, it also limits some of what they can get in terms of medications for the COVID-19. There are monoclonal antibodies, actually an antiviral that we use, remdesivir, and when they have significant kidney issues, they immediately are disqualified from getting that medication. So that's the problem. So they in themselves then are not getting the full treatment that they can potentially get, and that puts them at an additional risk for increased mortality and increased death. So that's a big issue. So with the high blood pressure, the diabetes, I mean, just someone getting very sick with high blood pressure, diabetes, and ending up in the ICU, there are lots of complications. But with a pneumonia that is aggressive, with diabetes, they're already immunosuppressed. Their immune function doesn't work well. It just puts them at increased risk for problems. And maybe Dr. Raphael or Dr. Leonard Richardson can speak to this.
Well, thank you very much. Now, what about the allergies factor? Some people say, well, taking the vaccine could lead to allergic issues as well. I think you mentioned a bit of that as well. Dr. Lewis?
Excuse me, say that again?
Yes, I have a question that just came in asking about whether or not the issue of allergies is getting as much attention as it should in terms of people getting vaccinated.
Or you mean if they would have some problem taking the vaccine because of allergies?
Yes, yes.
I don't think that the carrier for the vaccine is highly allergenic, or that they're finding that people are having high rates of allergy to that. Maybe some of the other doctors can speak to that.
Yeah. So quickly, just even before that, I just want to add to what Dr. Lewis was saying. You know, in the Caribbean and in the African American population, you know, the incidence of high blood pressure and diabetes is just so high that, you know, we just need to take care of that, because those are the risk factors. I think we made mention about that the other encounter. Those are the risk factors that put a patient at a higher end to either be hospitalized or develop more complications related with the COVID, or ultimately death. And I think she did mention about the kidney issues. The combination of blood pressure and also diabetes ultimately affect the heart in a big time. And we see a lot of complications with COVID related to the heart almost at the later stages of the life. And all is because of really uncontrolled or long-standing diabetes and high blood pressure. So I think that needs to be clear, that those comorbidities are detrimental to the course of the disease. Now, in terms of the allergies, there have been a few incidences whereby people take the vaccine and they develop allergy. They develop something called an anaphylaxis. I mean, most of the literature that we've seen, probably just about 5 incidents out of 1 million doses that is given. So the incidence is extremely, extremely rare. And they think that it is probably more common in people that already have some allergy background. And if it's going to happen, probably 90% of the cases happen 30 minutes after the inoculation. So if it happens maybe 4 hours after the inoculation, it's probably not related to the COVID. So yes, there have been some few instances of allergy issues, but the numbers really don't back it up to think that it's a major concern not to have the vaccine.
I have a question because, as you can see, I was just taking a call, some callers who want to speak to me directly rather than to speak to the panelists. And the question that was posed is whether or not, if you're fully vaccinated, if you can still be afflicted. I think the question may have been answered, but for the benefit of the caller, he just wants some more reassurance in terms of, if you're fully vaccinated, you know, can you still get hurt and be hurt badly?
I think I'll try to answer that one. If you get vaccinated, the reason why you give a percentage as to how effective the vaccine is because, yes, there is a small chance that you may still get infected by the virus. So let's say you're taking AstraZeneca and the efficacious or the efficiency rate is 85%. I'm not sure what it is, but I'm just throwing 85% out there. That means that it's quite possible that 15% of the people who take the vaccine may get the virus, may still get the virus if exposed to a high enough viral load. If that were the case, what we have shown is that even if they are reinfected, the majority of those, at least over 90%, will remain asymptomatic. And if they get symptoms, it would be mild symptoms, so they will not end up in the hospital. So even those who end up getting the virus will not get to the point where they're ill and hospitalized and intubated and die. So that we have shown with 100% efficacy that it does not lead to severe illness that leads to death. So yes, a small portion may get infected, and that changes depending on which vaccine you get. Some have a slightly higher percentage rate. So, and this is not new. This is the same as with the flu vaccine, for instance, which is 50% effective. But we take the flu vaccine because what that does is it reduces your chance of getting the flu. And, you know, with herd immunity, once a certain amount of folks get the vaccine, then even more people are protected. So that's important. Another, and just to add a little caveat onto that, there are some people that are more prone to being infected more than once, even if they've had the vaccine, or if they've had the disease and they have antibodies. These are usually folks who are immunocompromised, or if they're on chemotherapy, or if it's a new variant. So if it's a time, that then makes a person more prone to the infection. So it would behoove folks to get, the more of us that get vaccinated, the more we can keep this germ, this bug, this virus at bay, and eventually, hopefully, eradicate it from, you know, our world.
Now, one of the questions, I'm coming to you, Dr. Sebastian, but you know, one of the questions that people want to ask me off air, they don't want to speak publicly on it, is this question. And the question is very simple, a very delicate question. The question is whether men will still be as active if they get COVID-19. I hope I choose my words carefully. We have children listening to the program, but I think issue of impotence may be the word I'm looking for. Has arisen. So if someone could answer that very shortly, I'm going to go to Dr. Sebastian, and I'm going to ask about children and adolescents in just a moment or two. Dr. Sebastian.
Okay, so regarding if men are still active, well, there's no study or proof that men are less active than they were prior to taking the vaccine. So there's actually been some reports that individuals who get COVID-19 infections suffer from impotence. I don't know how far those studies have gone, but there's been some reports that this happens. But I also wanted to piggyback on Dr. Richardson, and just based on my experience here in St. Kitts and Nevis, since we've had the outbreak, I have noticed that the people who are fully vaccinated aren't showing any symptoms if they have tested positive. The people who aren't vaccinated are showing more severe symptoms, it seems, based on my experience of what I've seen there in the emergency room. So the vaccine, it's showing real world effectiveness there, right here in St. Kitts and Nevis, in my eyes.
A question for Dr. Gillian Wint-Martin, questions I should say. To the issue of pregnant women, newborns and adolescents and children, what are some of the considerations here that you'd like to share with us in terms of getting infected with COVID-19, getting severely ill? What kind of diseases have you seen, let's say, in children caused by COVID-19, and what preconditions in children could actually cause serious problems? You know, I hope I'm not too convoluted and you get the sense of what I'm asking you.
So yes, there's a lot of parts to that question, of course, but in terms of pregnant women, there's not a lot of research done on pregnant women just because of the ethical issue of, you know, testing a pregnant woman. However, women who became pregnant after they got the vaccine have done well, and there's literatures out there that states that. And it has also shown benefits to the child, the baby after the infant is born, giving protection to the infant after birth. In terms of children, one of the most complicated adverse effect of COVID-19 is the MISC, which I had talked about the last time. And basically that, I'm assuming that even the death that we had talked about, the number of pediatric patients that had died from COVID-19, I'm almost sure that those can be attributed to they had gotten an MISC that wasn't diagnosed readily and wasn't treated appropriately. So one of the things I like to emphasize is that although we have talked about the fact that kids are usually just mildly affected or sometimes asymptomatic, personally as a mother, there's still the risk of death, there's still the risk of MISC, and so you don't want it to be your child. If there's a small percentage, you don't want your child to fall within that percentage. And we still can't lose sight of the fact that kids have chronic illnesses. Kids have kidney disease, kids have asthma, they have cystic fibrosis, they have diabetes, they have Down syndromes, and some of them have a lot of heart conditions such as congenital heart defect. Kids suffer from HIV, obesity, and sickle cell anemia. Those are all chronic illnesses that makes them higher at risk for complication of COVID-19. So although we talk so freely about that they have mild symptoms, even if your child is one of the children that don't have chronic illness, they're going to school with kids that have chronic illnesses. And so, as a responsible society, we function because we look out for each other. We function because we're aware that, something that's happening to me could affect someone else. And a part of that is to make sure that our children, when they go out into society, when they go to the classroom, when they go to, functions, that even though they're healthy kids, they're not exposing kids who are immunocompromised or who are higher risk. So, so that's I might be missing parts of it, but if I'm missing any part, if you don't mind, saying what which part I'm missing, but in a nutshell, hopefully I answered the multiple parts question.
Well, I think you did a great job, but if any other doctor would like to chime in, I have a question for Dr. Richardson, which is related to the question I posed to you just a while ago, and that is if people now, not just pregnant women or children, adolescents, people in general, if they get seriously ill, what are we talking about in terms of treatment? From your experience, what sort of medicine are you talking about? What sort of equipment? How do you prepare for that eventuality in small island developing states? What type of conditions, perhaps? Of course, we heard about that as well, some of the conditions, but if there's anything else you'd like to add to what was said before? Dr. Richardson.
It depends on, number one, where you're going to meet these people who are ill, for instance, and what's available where you are. Different Caribbean countries have different shall we say, different facilities, different access, so forth. If you are in a country in the Caribbean like Puerto Rico, then you have access to the monoclonal antibodies that you can take if you meet certain criteria and you have one of the comorbid conditions, the sickle cell, the obesity, the asthma, congestive heart failure, cardiomyopathy, diabetes. If you have that and you come down with COVID, yes, we want to give you monoclonal antibodies and get you into the hospital. Get you a transfusion as soon as possible, because this is shown to reduce your hospitalization rates. Now, if you are at the point where you need to be hospitalized, and one of the things that we look for is the oxygenation level. So we're usually checking to see where the pulse ox is, which is the saturation, the oxygen saturation, and we are then admitting you. Usually, if you hit 93 or anything 93 and below, we need to monitor you. And you have to be careful, because as one becomes hypoxic, there's a feeling of euphoria. So you may feel that you're doing quite well and you may not need to be hospitalized. That's why we tell folks to see where your oxygen level is. And then when it gets to that point, there's usually a period around maybe 8 to 10 days after you've been infected where you can go either way. You can either slowly improve with a little oxygen via nasal cannula, or you can suddenly deteriorate where your oxygenation level falls to the point where you need oxygen. Now, at that point, you want to intubate somebody. At that point, you want to put off the intubation as long as you can, using high flow oxygen if you must, putting folks in the prone position. If they're awake and can do it, you try to do it for as long as tolerated, because that's shown to increase your oxygenation level. You want to start adding the steroid treatments like dexamethasone, the antivirals, and some people may be candidates for convalescent plasma, which is plasma that's obtained from people who have been infected with the virus, so they have antibodies for that. So that's one treatment that we use. And, you know, this has shown to sometimes prevent the condition from worsening. So that's one thing. Now, if the condition continues to worsen, and it happens, there's a certain percentage of these folks that will worsen, then it becomes a point where they have to be intubated and put in a ventilator, and they're in the ICU. And at this point, you know, it's being managed by the intensivists. You usually like a high PEEP strategy where you're giving a lot of PEEP, which is the way we set the ventilator. You want a low tidal volume. And, you know, I won't get into the technical aspects of how you treat that person, but that person, you're usually more or less doing everything for them. You're feeding them artificially, you're breathing for them artificially, you're turning them over and putting them in a swimming position, in that prone position, and you alternate arms, which is why they call it a swimming position. And that's to prevent skin breakdown from areas where there might be too much pressure. So and you're talking to the family, because at this point this person is very sick. Depending on where you are, you can then even get into heroic measures like ECMO and so forth. So, you know, it can be pretty extensive depending on what you have available, or it could be simple. So what you want to do is develop a good surge capacity. You want to have an idea of what's coming down the pike. You want to have an idea of your population size, what your hospital can handle, how many ventilators you have, and just an idea of what the potential death rate could be. I know right now in the US, our death rate was about 175 people per 100,000. But worldwide, it was about 30 per 100,000. So it was a little lower worldwide, and we think it's because they had a younger population worldwide, and in the United States we have an older geriatric population because of I guess the advancements in healthcare. We can keep people older longer, so and they're the most vulnerable to COVID, so we have more people dying from that. So in general, it's a step-by-step process, and we manage people just based on where they are and based on where they are physically and where they are clinically. So if you are deteriorating, you get managed a certain way, and if you're in a rural town where we don't have all those amenities and we can't get you to an urban center where we have the tertiary level center, or you can't be air vac because you're too unstable, and that could be you're in a Caribbean country that they don't have all these amenities and facilities, then we just have to go with what we have and do the best that we can with what we have.
And of course, I'm going to have to ask Dr. Sebastian, because people listening to the program will say, well, what about us? What about St. Kitts? In terms of, in the context of what we just heard, in terms of resources and equipment, how much can you tell us?
We do not have monoclonal antibodies here in St. Kitts and Nevis. I believe we have over 30 plus ventilators here in St. Kitts. There's one in the emergency room. There's several obviously on the COVID-19 ward. There's some in the ICU. We have a couple over in Nevis as well. But we don't have anything near to the level of resources that they would have access to. Even simple resources like even getting certain procedures done in radiology that can be time consuming at times because we have to get our staff gowned and they would have to come to the actual ward to do it. So it takes a while. So to get certain things done, it can take time. To get lab results, that can take a while as well. Even when I practice in Jamaica, I can get lab results in, let's say, 15 minutes. And that's because they had a much larger lab and the capacity to do those things. In St. Kitts and Nevis, we don't. So it can take, sometimes hours at a time to get certain labs that we may need right away. So sometimes we just have to treat based on the clinical presentation and hope that our clinical skills are right until we get these results. So we're nowhere near at the level of the United States of America or any other first world country when it comes to resources. So prevention has always been preached here because we know our position here already. So that's why the focus has always been strongly on the vaccine here to prevent us from having to deal with such a situation.
Well, thank you very much, Dr. Sebastian. What I'd like to do now, I'd like to, with your permission, invite the panelists. I'll give you a minute each again in case there's something you wanted to say and you didn't get a chance because we're dealing with a decent-sized panel, right? So I don't want you just to get frustrated. So I'm going to come back to you now, give you each a minute to just fill in the blanks or the gaps that you've noticed, and then we're going to talk about the economic impact. So who would like to go first there?
One of the things...
You can go, please.
One of the things, just piggybacking on Dr. Richardson, is just simply talking about personal protective equipment, just the availability of personal protective equipment, because that is such an important part of managing the spread of disease. Once you have patients in the hospital, making sure that the staff themselves have enough PPE, patients themselves are properly quarantined in rooms that have maybe special airflow. So even just some of the physical plant issues as well as just protective equipment can make management of of a COVID-19 surge or outbreak even more expensive and more, I guess, just difficult to manage.
Right. So, I'd just like to, speak to the people of the Federation and around the region that, sometimes I feel a little bit frustrated and forgive me for that, being a scientist, for the whole vaccine hesitancy. And the panel also feel this way. That's why we're here, feeling a little bit that the discussions that we're hearing are a little bit too small-minded and pedestrian and futile at best. And, we didn't have, it's just too cynical for me that we have a strong science and math program in the Federation. We have several tertiary colleges, University of the West Indies. We have medical schools there. We have at the secondary level, we have CXC, strong science program. When we come overseas, we compete against any culture in the world. Believe that. we are a representation of that. So our parents sacrifice our sons and daughters to send us to the best schools in the Caribbean and in other developing countries to become scientists and medical professionals. But for some reason, we prefer to defer to fake videos on social media and propaganda. So if this is happening, it means we are not getting back our return on investment from all the professionals that we have educated and trained, and for them to recommend to us the most prudent path to take. So I'm just appealing and pleading to people in the Caribbean. We have invested so much in becoming educated on over the condition that we came out of. We just can't go back to the past. We just can't live by superstition and people pretending to be the professionals that they're not in a particular area. When you spend all of your GDP, a significant part of your GDP to get us where we are today, and for those people like Dr. Sebastian and your CMO, Dr. Laws, who was a classmate of mine, Dr. Cameron Wilkins, who was a neighbor of mine, and all the medical professionals that are serving you. For me, I'm passionate about this. You have to listen. You have to save lives, and you have to save your country, your economy.
I just want to, when you talk about things that I just want to emphasize or piggyback on, I mean, I agree with the continuing the solid mitigation efforts. That is our best first line of attack. Social distancing, just got to keep that up. The 6 feet apart, the hygienic measures, hand washing, sanitizer. We know that most of the transmission occurs indoors. So as much as you can lower your chance of getting it. It transmits less outdoors. And I know some folks are saying, geez, we only have one dose of the vaccine. And I just want to emphasize that one dose of the vaccine gives you somewhere between 60 and 76% protection against the virus. So you are still getting a ton of benefit, a lot of benefit, even with one dose. Yes, we still need the second dose, but you're at least 60 to 76% of where you can be. There's one more point I wanted to make as we talk about vaccines. I mean, there's experimentation going on all the time. Right now, even though the CDC does not recommend it, for instance, we're now looking at, can we mix vaccines? Can you take Pfizer and AstraZeneca? Can you do that? And initial studies have shown that you are getting a bit of a robust response. That's not ready for prime time yet. But the CDC does not recommend it. Let me put that out there. But these are the things that we have to do as the world has a shortage of vaccines. So people have been doing this, and as it's being done, we're looking at the efficacy. We're studying it and looking at it. So listen to your folks on the ground. I'm going to emphasize that again. These are the guys who have put the effort in. Your CMO, your chief of staff of the hospital. These guys are guiding you with steady hands, and I support them 100% in the measures and the direction that they're giving you.
Wonderful. Yeah. I think the panelists have said a lot. Where I work, is mainly hospital service. And I've always said that, when you try to tackle the COVID issue in the hospital, you've already lost the war. Most of the people that will come to hospital, we classify them as being severe COVID case, or they are actually crippled. So either one of them, the case fatality is extremely high. And if you get a lot of them and they flood the hospital, then even the very minor cases can easily develop into critical cases. Even with what we say is a standard of care, which Dr. Richardson has spelled out, we give them remdesivir if there is an indication. We give them the Decadron. We give them tocilizumab, which is an IL-6. We've given them everything. Listen, they still die. And that is the sad part of it. You put them on ECMO in the institutions that they are fortunate to have them, they still die. So, when you look at your critical case fatality of 49 to 50%, even the ones that come out alive, the aftermath is just so devastating. They spend, months sometimes in the ICU, and then after that, they have to go to rehab for a very extensive period of time. So I think the best thing that we have in hand is prevention. And as the other panelists have said, the social distancing, face mask, but above all of it, what we have seen that it's working is the vaccine. And as I said from the beginning, I'm yet to see a patient that I'm admitted to the ICU that is vaccinated. I've not seen that. And that's my message for tonight. Thank you.
Just wanted to jump in at this point. This question was asked a few minutes ago. I think Dr. Raphael had answered it about if you have allergies and allergic reactions to the vaccine. I think one thing that, I don't know if that's the same thing that's done in St. Kitts, but I know in America, after you've gotten the vaccine, you wait for a period of 15 to 30 minutes before you leave the facility. And because we know that most people who are going to have an allergic reaction to medication or, vaccination is going to take place within that time frame. And so there are going to be healthcare providers who are readily available to help in a situation if you develop what we talked about, which is a severe allergic reaction. And just bear in mind also that people who take antibiotics every day, you take amoxicillin, you take penicillin, you take different antibiotics, when you go to your doctor for different illnesses, there's always a risk of allergic reaction to those medication. So the risk of allergic reaction to COVID-19 vaccine is no greater than it is to other things that we take, aspirin, Tylenol. And then to close, I'm just want to talk directly to parents out there who have kids. I understand what you're going through. It's a complex situation. You're worried that, am I going to take this vaccine? And if something happens to me, who's going to take care of my kids? Just from a Caribbean perspective, we have a lot of single family household. And, when you have kids who are dependent on you, especially as a mother, you're like, well, if something happens to me, I don't have anyone to take care of my kids. I'm afraid. But we know that COVID-19, the chances of death from COVID-19 is much higher than any side effect or whatever mention complication that has come with the vaccine. So I implore you, our kids need to get back to normalcy. Our kids need the anxiety of being at home, not socializing. We need to alleviate that kind of stress from our kids' life. I can't imagine as a child missing a whole year of school, not being around my friends, not being able to participate in sports and activities that I enjoy. And so I know that, sometimes kids aren't verbal and they don't even understand what they're going through, but, behavioral change and all that, we know these are because kids are stressed at this point. So I implore parents, we don't have the vaccine for kids at this point, but I do recommend that parents who are able to take the vaccine, go ahead and protect your children by taking the vaccine yourself. And when it becomes available to your children, I advise you, just like I did with my own kids, go ahead and provide the normalcy that your children desperately need.
Well, thank you very much. I have some questions. Again, you may not hear our listeners on the phone lines. They're speaking to me privately, and they want me to pose the questions to you. And we also have questions coming in via our platform. So I'm just going to throw these questions out before we go to the economic aspect of things. Question 1, what do you give to children who have COVID-19? How do you treat children who have COVID-19? Question 2, people who have been fully vaccinated, have they also been infected by COVID-19 in the Federation? And the other question is, would anyone in the panel comment on whether or not there should be a policy that you should be vaccinated, or if you're not vaccinated and you work in the service sector, that you should be required at your own expense to offer proof to your employer to remain occupied? I see Dr. Martin smiling, so I know he's going to deal with the politics, but we could talk about the medicinal aspects of our conversation. So I'd like to invite Dr. Sebastian first, and then, of course, I'd like to invite the other Dr. Martin, Dr. Wint Martin, about how you treat children with COVID-19.
Can you repeat the first question then?
All right, so what do you give to children who have COVID-19? What is recommended?
Well, here in St. Kitts and Nevis, we don't have access to all of these medications here, but what we do is we treat supportively. So we have supportive care. So if a child needs, oxygen, we will supply oxygen to the child. If the child needs pain medication, we'll supply pain medication to the child. If we do some labs and we notice anything is off, whether it's their electrolytes or anything like that, is some sort of imbalance, we'll correct it. If the kidneys aren't functioning well, we'll bring our nephrologist in, and the nephrologist will look at the child. So it's really all supportive care that we have here in St. Kitts and Nevis. So we don't have medications, at least monoclonal antibodies that would help in severe situations, but mostly it's just supportive care here.
And the fully vaccinated?
The fully vaccinated.
Being infected by COVID-19.
So it's possible to be infected with COVID-19, to test positive, being fully vaccinated, but I have not seen any sick, fully vaccinated individuals in St. Kitts and Nevis.
Dr. Wint Martin, children?
I would have to agree with Dr. Sebastian. In America, there really is just supportive care. Yes, if children develop the severe complication of the MIS-C, then they would be admitted to the ICU and IV fluids. But even the remdesivir, it's not highly recommended for pediatric population. We've had a few cases in the ER where kids have come in for transfusion, but those were kids that were over age 12 and they had other chronic illnesses that put them at severe risk. But most specialists that we consult with in the ER really don't recommend it for their patients. So for kids under age 12 for sure. So it's really just supportive care, and that's why it's even more critical that people who can protect these kids do the right thing and protect them, because basically they're defenseless. If they have the severe form, then chances are you could be looking at a child with a dire outcome.
I have another medical question before I go to Dr. Martin to answer the question of policy. I'm going to put the question how I got it. So if you don't understand it, that's how I got it. If I have platelets, can I take the vaccine? If I have platelets, can I take the vaccine? Dr. Sebastian, do you know what that means?
Okay. No.
You don't know?
No, I'm not too sure. Right. I mean, we all have platelets in our bodies. They're used to...
They probably mean if they have low platelets.
Low platelets.
Yeah,
so, yes.
that's what.
I think so, yes. So what's the answer? And thank you for helping me with the question.
Oh, thank you. That's a good question.
Anyone?
Yes.
So hold on, we stumped the panel tonight? This has to be a celebratory moment. Go ahead, please.
Yeah, I think that's a very, very important question. And it's going to depend on what is termed as low. So usually a platelet count of 150,000, which is what we normally say, is low, but it's really not critical until it hits about 50,000. Yet there's really not any literature that says it's an absolute contraindication to give the vaccine. Now, however, there have been these complication or some rare, extremely rare side effects associated with the either Johnson & Johnson or the AstraZeneca vaccine, which is the vaccine-associated thrombotic thrombocytopenia, whereby for some immune-mediated reason, we think that the body forms clots and then chew your platelet count. So that would be probably the only indication whereby if you have extremely low platelet count and will be a contraindication to have it. But then you would not know if you are somebody that is going to develop that complication or not. So that is really not an indication to say you don't want to have the vaccine. That clotting issue is known. We think it is probably a little bit more common in females less than 50 years old. But as I said, that complication is extremely, extremely rare.
Thank you very much, Dr. Martin. The issue of policy, which I think is embedded in all discussions on rights, individual and collective rights, human rights. It's linked as well to the exchange of labor for capital, employer versus employee. And the question is, how do you treat with the issue of getting the economy back on its feet, if you like, or foot, if both are not available, just one, just to get started? Your thoughts?
Yes, so thanks for that very pointed question, Mr. Backus. So one of the issues with respect to the Caribbean is the fact that we spend a huge part of our GDP which is assigned to tourism. And with cruise ships being stopped, with many of our tourists coming from parts of the US that has their problem with vaccine hesitancy, with 7 million Americans still out of a job who was employed before, with remittances coming to 8% of remittances contributes to Jamaica GDP and some other Caribbean islands. You can see the economic impact is not just about vaccine hesitation and COVID in the Caribbean, but there are also external forces which affects us, like the fact that we're so deep into tourism as a GDP support. Now, St. Kitts has 60% of its GDP in tourism. That's 60%. That is a huge amount. And of every Caribbean country, besides the British Virgin Islands, we are highly dependent on tourism. So you could see that what hole we could be in if people don't vaccinate at home, and we are also depending on tourists to come in that may also be non-vaccinated, and how that could impact our country on a whole. So the point is, I've always said this when I've been on your show before about technology and the fact that we need to diversify our economy. And this is not a criticism of any of the leaders in St. Kitts, whether in office or out of office, but the fact that we have spoke about diversification since I was a kid from every Caribbean leader, and also in my own. And where is the political will to look at areas that we could grow in, and we have the educated personnel to participate in those areas, such as biotechnology, to look into areas where we could start looking at infectious disease and start looking at some of these technologies, DNA, RNA vaccines and protein and adjuvant type vaccines. Those are things that we could do. I know the resources required to do that. Like I've mentioned to you before, Mr. Backus, it's not like we're going to be building an electric car. These are lighter industries that require less labor force, if you will, but more highly skilled labor force, and also less intensive, capital intensive equipment. And secondly, when you look at the areas that these technology that can support, such as biotechnology, we're looking at food, right? We have a food security issue in the Caribbean. 80% of the revenue that we get from tourism, or all the revenue that we get from tourism, 80% of that revenue goes back into food import. So we have that food security issue where we import in so much food and not all of it is considered to be good, nutritious food. So we have to change the way that we do things in the Caribbean and in the region. This COVID crisis presents us with a unique opportunity to redefine the social and economic policies, putting the well-being of sustainability at the center, to have a more robust healthcare, like you've heard what Dr. Sebastian said about, what type of resources we have, to be more creative and inclusive financially, the systems we have. We need to close the food security gap that we have, and we're going to have educational gap created. The strong education system we have, we're going to have a little setback. So my plea to leaders is to really look at COVID-19 as a way to reinvent ourselves, if you will, and become truly independent, with the fact that we're so dependent on foreign entities for our pharmaceuticals, for food, and we have the audacity to question the drugs that we import when we ourselves don't want to be participative in the world economy and develop the things for ourselves. If we're gonna be calling ourselves sovereign, independent countries, we have to think differently about becoming truly independent. So when we inject our kids and ourselves, we could be proud that maybe it's coming from us, but it's 5, 10, 15 years from now, rather than being so critical of the things that are produced overseas as life-saving. So my point is that we're dependent right now. We're in trouble because the remittances may not be coming, the tourist dollars may not be coming, and we're so dependent on those things. The citizenship by investment for some of those countries that are very dependent on that, you have to give up something to get something. What are we giving up? Are we giving up our land? We're giving up other things? So we have to think differently. So COVID-19 and to get a more robust healthcare and economic system, if you will. I hope that I've answered your question, Mr. Backus.
Well,
but,
I think you've raised so many issues. You're going to have a special sitting of the United Nations to deal with those issues that you've raised there. I will invite the doctors on the panel to consider their parting comments. I know very often medical professionals are very shy when it comes to some policy issues, but to add to some of the issues you're speaking about, there's this ongoing discussion about remittances. I'm just going to go on for a little bit with Dr. Martin for a minute or so about some of the issues he raised. Now, when we look at remittances, and we look at two sets of remittances, we look at financial and social. The financial one, according to some of my latest research, suggests that the top 3 countries in the Caribbean in terms of remittances will be Dominican Republic, $8.3 billion US dollars last year. Haiti, $3.1 billion US dollars last year. And guess who's coming in at number 3? Anyone wants to raise a hand and make a suggestion? Number 3? All right, I'm going to raise my hand. Number 3 is Jamaica.
I was going to say that.
Jamaica, $3 billion US dollars in 2020. You spoke about the food import bill. And when you talk to farmers across the region, because I've been lucky enough to cover agriculture for a number of years, we've been speaking about agriculture for so long that it's almost like it's an old song that you've heard it so many times. The issue of financing, vulnerability, limited land space, the international standards that they have to meet, the competition. What is the food import bill for last year? $4.5 billion US dollars. $4.5 billion US dollars. And to speak about travel and tourism, the estimate for last year from the World Travel and Tourism Council suggests that in the Caribbean, about $34 billion would have been removed from the Caribbean economy. 34 billion US dollars. So with all of that we're talking about here, the question is, are we doing enough with our brain pool, with our capital, in terms of the social remittances, in terms of your ideas and best practices? Are we doing enough with the agriculture? Are we talking a good talk? Are we walking the talk? And how do we build the consensus necessary to deal with these big issues? Doc, the floor is yours. I mean, help us. We need help. Where do we start with all of this? Or do we have to put it off for another program? What do you say, Doc?
So which doc are you talking to? Because
Well, I know there's only one doc is going to speak about politics tonight. I have the impression because the other docs have become very silent. It's like a silent movie with these people. They're just sitting there watching me, man. If anybody wants to chime in, feel free.
So I've said, Mr. Bacchus, that I've spoke at the Eastern Caribbean Bank about a month or two ago about avenues that we can partake in order to solve some of the issues with respect to having a monopolistic, one-sided GDP and expanding in the areas of education, tourism. I think St. Kitts is doing a good job of that already with some of the offshore universities, medical schools we have. I spoke about medical schools and having a more expansive medical school and other areas such as information systems where we're going in to support 5G. Then the big one is the biotechnology that I think we have really a good opportunity to plan where we could have several adjacency businesses, markets from it. You could do cosmetics, you could do biosustainable goods, there's hemp seed, there's the hemp plant itself. You could do, export to other countries. We talk about food processing through biotechnology. We talk about agriculture and the same DNA that you're hearing about and the DNA manipulation. Well, you eat a lot of genetically modified food. Trust me, 80% of the food that comes to St. Kitts is modified rice, modified wheat, modified corn, canned, everything. It's highly processed. Well, we could do some of that organically through some biotechnology and participate in gene modification to help in plant resistance from climate change and insect damage. We could also look into therapy, right? Stem cell therapy. I think we tried a couple years ago, but there's some issues with respect to biosafety. And then there is the whole concept of DNA. I've done that area before, recombinant DNA, some of the work that have been done with vaccines. Some of my PhD work was done on manipulation of genes. So those are the things that I think we can do. We have that lab in St. Kitts, which I visited, where they do a lot of the research with the monkeys. So it's not like we're totally dismissive or we don't have the competency to do stuff like that in St. Kitts and in the other Caribbean regions. we just have to really, as you said, Mr. Backus, kind of put our minds to it. I don't want to use the language to describe why we haven't done it, but we have to make an effort to do that and participate in things that would help to build our communities and build generational wealth, as opposed to having the quick jump up, the festivals, the cruise ship coming in, and we think that the US dollar or the pound or the EU, that's going to take us for generations and generations. If we're thinking that that's a mistake, we need to start to present a new paradigm to people in the Federation and across the Caribbean region to engender a new type of economy.
Thank you very much.
As you said, it takes a whole nother session.
I'll have another program for that. But I want to thank you very much for engaging in a discussion on the policy issues. I'm now going to invite the panelists to begin their wrap-up. I'm going to offer you 2 minutes. And, of course, you feel free. If you want to speak on some of the issues we raised, it's up to you. I just don't want to call anyone and put you on the spot, and perhaps you'd rather not. You may not be
Well,
one.
let me make a
Okay.
comment. Let me sort of bring this back to the topic that we were talking about. So I think we talked about the right of somebody to vaccinate versus this being imposed upon them, and how this will affect the economy. Now, non-communicable diseases are a threat to the social and economic development of the Caribbean in general. That was a focal point of CARICOM. And in general, we need to focus on the general health and well-being of our people. What does that mean? We need to figure out who we are and where we're going. So we have to, I think we are more of utilitarians. We believe that the greatest good for the greatest number of people. I think that's who we are in the Caribbean. We're not a autocratic society. We are a society that believes in doing what's best for the majority of us. So, the theory of morality, you have the social, the economic, and the political, and everything should aim towards the betterment of society. So I think that's what's important. What can affect the society, or what are the economics of COVID? Having a shortage of vaccines and slowing down inoculations could affect the economy. So things like that. Not having a robust vaccination program could affect the economy. The positive predictors for the economy would be a robust vaccination program, smaller population, which we have, and a more equitable distribution of vaccines across the borders. We tend to have that in St. Kitts, so we should celebrate the things that we do have. If we were in some of the other countries that didn't have the equitable distribution, and we see it all the time, they have negative predictors on on their economy. So we should celebrate the things that we do have. And in terms of employment, I don't know what all the laws are in St. Kitts. I do know in the United States, the EEOC, which is the the Equal Opportunity Commission, they recently, within the last 2 weeks, just passed the law here that employers had the right to mandate that all folks be vaccinated if they intended to work in that facility. So that is now literally the law here in the United States. And I predict that's going to happen going forward, because we have to think of the betterment of the entire society. So, because, what if it affects one will affect all of us. So yes, I believe that folks have a right to refuse the vaccination. However, if that right imposes on everybody else's right to live, then that becomes a problem. You can't yell fire in a movie theater. Yes, you have the ability to say the word fire, but if you yell it in a movie theater, that is now illegal. So you have to look at the context and how it's going to affect everybody if we don't get on board and vaccinate. So that's my foray into the political arena. I'm going to step back. I don't get any deeper than that.
He did very, very well. Thank you so much, Dr. Richardson, for your contribution, Dr. Leonard Richardson. I'd like to invite closing comments from Dr. Colette Lee Lewis. Dr. Lee Lewis. I think it might make me off.
Yeah.
Yes.
My comment will be brief. Essentially, the only thing I would say is vaccines work if we use them. I mean, if we don't vaccinate, then we don't have the protection from COVID-19. And then the other thing that I would appeal to people when we speak about vaccination is that we know that most people are fiercely protective of their families. So see COVID-19 as the enemy. See COVID-19 as threatening the well-being of your family, the well-being of your health. And we know that health is probably the most important asset that we have. So we know that if you're not healthy, then you can't work. How does that impact the family? So if you think about it from that standpoint, I think that also should be would give added impetus to think and strongly consider vaccination. But definitely remembering the basics, social distancing, sanitizing, and definitely considering vaccination to help not only our persons, ourselves, our families, but the nation at large.
I mean, thank you very much for your time, Dr. Colette Lee Lewis, for being with us this time around, as well as the first time. Thank you so much for your time. Dr. Raphael Kwanzaa?
Yeah, I think mine is also in the realm of the same sentiment that has been expressed in this panelist. I will say that anything that we do by force, it's probably not long-lasting. We surely need to appeal to the conscience of everybody to understand that this is a pandemic, and as a pandemic, we need to do things that will combat it before it takes our life. I know most times when the politicians talk about this, we tend to look at it, differently because, some tone of politicizing comes into play. So I would want that, more than the politicians talking about it, I want our teachers to talk about it. I want our police officers to talk about it. I want our pastors to preach about this. I want the JPs in the communities. I want the community leaders to lead the way. I want the celebrities to talk about it. This is real. I want the sports coaches. I want the podcasters. I want radio personalities, other celebrities to understand, to talk about this, and to appeal to the common consciousness of everybody that this is real and we are in this together and we have to fight it together.
Well, thank you very much, Doc, for being here as well, and thank you for your contribution to the program. Dr. Wint Martin?
I guess I'll just basically reiterate what everyone has said. But more so, just think of the fortunate position that the Caribbean is in right now. A year ago, many of those people who have died would have done anything to have gotten the opportunity to live. And we're in a unique position where the vaccine is available. So there's a chance, of life, chance of returning to normalcy, chance of giving our kids opportunities to flourish and to succeed. And so I would say to the people in the Caribbean that they're in a much better position than, and at least in St. Kitts, the fact that it's just now starting to have cases, you're in a great position because you have an option. You can be vaccinated. While a year ago we had no option. People who got it and died had no choice. There weren't any options for us. So my advice would be take advantage of the unique situation that you have available to you and vaccinate.
And thank you as well for your participation and your expertise on this evening's program. I'm going to go now to Dr. Sebastian, Dr. Cuthbert Sebastian.
Okay, so my final words are, like Dr. Whitmartin said, we are in a unique position here, especially in St. Kitts and Nevis, where we have access to vaccines, which are safe and they're effective, and I've seen that they are effective here right now with the situation that we're going through. We should take advantage of this. I will continue to educate as we're going through this, because people still have their concerns, and with the way social media is and the media is in general, I'm sure people will develop more concerns. So I will continue to educate and dispel whatever may be false or misinformation here in St. Kitts and Nevis. And just to let everyone know that a vaccine is only as good as the amount of people that get it. Me being vaccinated by myself will not help the country. It takes the population for this vaccine to work. So we really need to get to herd immunity for this vaccine to be really effective for us. All right, thank you.
And thank you very much, Dr. Sebastian, for being here with us in the studio of Win FM 90.9. Of course, we're streaming on ZAZ as well. And we have the final comments from Dr. Arthur Martin.
Yes, I think I just want again to thank all the panelists for the wonderful job they've had to educate and disseminate the information to the masses. Now, from a credible information standpoint, I would like people to reach out to PAHO, the Pan American Health Organization, WHO, World Health Organization, CDC, Center for Disease and Control, the New England Journal of Medicine, the Medical Association of Johns Hopkins Coronavirus. These are all credible sources. You do not have to go to fake videos and other non-credible internet sources anymore. I've provided you with some. I could pass some of these to Mr. Backus. I'm sure you have some of them already. Now, another thing I'd like to say is, you know, I've had 2-3 weeks ago, before we did this panel, I had conversations with Dr. Sebastian, and he was very, very sincere and was very frustrated and disappointed. I could hear it in his voice of this high degree of vaccine hesitation and the work that they've been trying to do in the Federation and trying to encourage people. And his comment was that they don't know what could hit them. They're not taking it seriously. And we see the current spikes over the weekend coming into this week. And so I'd just like to say again to the people in the Federation that, you know, you get your gold water or your double bonus at Christmas. You may have gotten some stimulus money during the course of COVID. You have you have a check, a free check, right? It's the vaccine. Go cash it now. And so that's sort of my my spiel on that. And in any crisis, we must always do a lesson learned. And as a community, we should. COVID-19 produces the political will to move toward better policy frameworks. And you've asked me quite a bit about that, and also execution, and find some positive ways for us to come out of this crisis. And so again, I said to the people of the Federation and the Caribbean, go and vaccinate and keep your community safe and protect your economy and your enduring work over decades and decades. Thank you.
And thank you very much, Dr. Winston Martin, Dr. Cuthbert Sebastian, Dr. Colette Lee Lewis, Dr. Leonard Richardson, Dr. Junine Wint Martin, and of course, Dr. Raphael Kwanzaa. Thanks to Trent Sargent, who's providing technical assistance, Jade Johnson, and of course, Mrs. Jiluka Harmony Brown, who also assisted with this program. Thanks so many listeners, and thank you for your questions, and thank you for your participation in the program. We wish